Hi, I'm Mike Ortiz. I'll be your student nurse today. And today I was looking at your records and it says that the doctor would like you to have a Foley catheter put in. Do you have any questions or concerns? Okay. What a Foley catheter is a catheter that's inserted into your bladder to help with elimination. Do you have any pain? Any further questions? Okay, can I get your name, please? Your date of birth? Okay, perfect. I'm going to go ahead and close the curtains, give you some privacy, and I'm going to go ahead and raise the bed to a working height. If nothing else, I got that part down. So I'm going to go ahead and expose you at this point. And I'm going to go ahead and pull this back and get you positioned. I'm going to perform hand hygiene, and I'm going to go ahead and put some gloves on and perform pericares. Okay. Alright, so clean. I'm going to remove these. I'm going to perform hand hygiene again. At this point, I'll go ahead and open up my package. Throw away the plastic and the insert. We'll open it away from me. I'll open the two sides and I'll open it towards myself. I'll go ahead and throw away these gloves because I don't need them, and I'll throw away the little white insert, and I'm going to open the sterile field at this point, shaking it and placing it underneath. And then at this point, I'll go ahead and put on my sterile gloves. I'll go ahead and take this and take a step back so I don't contaminate. Okay, that did fold over on my other gloves, so I would at this point go ahead and remove gloves. Start over again. But I'm going to go ahead and reopen it and resume. I'll step back with my thumb up, hitchhiker. Glove on. Okay, at this point I'll go ahead and remove this kit, place it in the sterile field. I'll go ahead and open my backcitracin, throwing the cap away or the type away, and I'll pull out my 3 swabs. I'd go ahead at this time, pull out my lube, throw that away. At this time I would go ahead and remove the catheter and inspect it. I would take the syringe and I would go ahead and insert it after I remove the black cap, and I would go ahead and remove the plastic sheath, wrapping this around to prevent it from losing its sterility when I put it back in the box. Okay. At this point I would designate my hand that I would use for the peri area. I would go ahead and I would clean far, making sure I don't cross my sterile field, near, and then down the center. And then at this point I would go ahead and get the catheter, and I would insert the tip into the lubrication, ensuring that I get a nice coating. And I'd let the patient know that it would, that she would sense some pressure. And I'd go ahead and hold her breath, and I would insert the catheter. Slowly inserting until I saw urine, and then continuing about 2 to 3 inches past that point. After that, I would go ahead and grab with my hand, and I I would pinch this slightly, and I would go ahead and insert the 10 mLs of fluid into the bladder, ensuring that it all goes in. And then I would tug so that it's seated up against the bladder, and I would remove this and throw it away. At this point, I would go ahead and dump the contents of this out, throwing this away. Get this over and start cleaning up some of my mess. Remove my sterile gloves. At this point, I'll go ahead and do hand hygiene. And go ahead and tape with a little bit of slack so that she can move. And I would go ahead and attach the bag to the side of the bed to a part that does not move. I would go ahead and redo hand hygiene, put a new set of gloves on. And I would perform period cares, making sure that there's no backcitracin left on there. I would remove these gloves and get the patient repositioned. Put the legs down, go ahead and cover you up. Okay, does everything feel okay? You have any kind of pain? I'd go ahead and cover you back up. Make sure that the call light is placed within reach of the patient. I'll notify you if you have any issues, any kind of pain. Go ahead and hit the call light. If you need to urinate, just let me know, and I'll go ahead and check the bladder. We'll check it. And then I would go ahead and lower the bed.